Prostate cancer is an extremely grievous disease in men and makes its patient's life like a hell. The prostate cancer patient wants to die but cannot, not aware. What is prostate cancer? As per Wikipedia, prostate cancer, also known as carcinoma of the prostate, is when cancer develops in the prostate, a gland in the male reproductive system. Most prostate cancers are slow-growing, however, some grow relatively fast. The cancer cells may spread from the prostate to other parts of the body, particularly the bones and lymph nodes. It may initially cause no symptoms. In later stages it can cause difficulty urinating, blood in the urine, or pain in the pelvis, back, or when urinating. A disease known as benign prostatic hyperplasia may produce similar symptoms. Other late symptoms may include feeling tired due to low levels of red blood cell. Factors that increase the risk of prostate cancer include older age, a family history of the disease, and race. About 99% of cases occur in those over the age of 50. Having a first-degree relative with the disease increases the risk 2 to 3-fold. In the United States it is more common in the African American population than the Caucasian population. Other factors that may be involved include a diet high in processed, red meat, or milk products, or low in certain vegetables. Prostate cancer is diagnosed by biopsy. Could prostate cancer be cured? Doctors say, if prostate cancer is diagnosed initially then it can be cured, but unfortunately advanced stage of prostate cancer cannot be cured. Prostate cancer is defined as advanced when it spreads outside the prostate gland. It may spread to nearby tissues, lymph nodes, bones, or other parts of the body. When it is spread beyond the tissues directly adjacent to the prostate gland, it is called metastatic prostate. There has been surfaced a very interesting research about a potential cure for prostate cancer, which is not much expensive and even a very common part of our daily food menu. British researchers did a research and concluded that if you eat 10 portions of tomatoes each week, then it could be helpful men reduce the potential risk of prostate cancer by 20%. Here I would like to explain that what is 10 portions of tomatoes? According to nutrition experts, one portion is counted as 150 grams of tomatoes, half a tin of baked beans, a portion of pizza with tomato puree, tomato-based pasta sauce, or a glass of tomato juice. Highly qualified researchers from UK's top universities, the universities of Bristol, Cambridge and Oxford, and this team involved 20,000 British men between age group 50 and 69 years and analysed record of their daily diets and lifestyles at Bristol University. After analysing the data, they came to know that those British men aged 50 and 69 years, who ate at least 10 portions of tomatoes a week, were 18 and less likely to develop potential prostate cancer compared to those who had none, or very few. Researchers say that a tomato has several cancer-fighting properties: cholesterol, sodium, lycopene, and other useful ingredients. And lycopene is a key chemical inside a tomato which can protect men from potential risk of prostate cancer, and this antioxidant property protects against damages to DNA and cell too. East or West, tomato is an obligatory part of our daily diet, and it would not be wrong to say that nearly every food recipe is considered incomplete without tomato. During the researchers found tomato sauce, tomato juice, and even baked beans and the tomato puree topping on pizza and other tomato-contained food items to have a beneficial effect. Vanessa she is the research leader of the University of Bristol, says, "Our findings suggest that tomatoes may be important in prostate cancer prevention. We also found men who ate more fruits and vegetables had a reduced risk of prostate cancer. The risk reduction figure for men who ate 5 or more portions of fruit or vegetables, compared to those who ate less than 2.5 portions, was 24%. Vanessa urged men to rely on whole foods rather than supplements and stick to a diet that includes a variety of fruits and vegetables, as well as staying healthy and active and maintaining an ideal weight. On the other hand, the researchers also suggest men not to overindulge in baked beans, pizza and pasta sauce, as they can contain high levels of salt. Other well-known experts comment on this research. Dr. Ian Frame, of Prostate Cancer UK said, "Studies like these are notoriously difficult to interpret and should be done so with extreme caution. It is not 100% confirmed that tomatoes can protect against prostate cancer. What we do know is that men shouldn't rely too heavily on one type of food, such as tomatoes. A healthy, balanced diet with plenty of fresh fruit and vegetables together with regular exercise is by far the best option."